I completed my Capstone project at Keene Family Medicine. This is my community clinical site where I follow a care coordinator. For my project, I decided to focus on medication adherence. In order to do this, I created a short survey and chose 10 patients to ask about their medication regimen. When I asked about the needs of the clinic, my preceptor pointed out the public health problem of medication adherence. This is what sparked my idea of creating a survey to figure out if patients are adhering to their medication regimens and any barriers to adherence they may have. The patients that I surveyed were all Medicaid patients, which made them a particularly vulnerable population due to socioeconomic status. All of the patients also had chronic diseases and were prescribed a significant amount of medications. Surveying these patients helps to identify whether or not patients are compliant with their medication regimen. It gives the care coordinator a good idea of how to further help patients if they are not compliant and how to address any barriers. This topic that I chose was particularly important to me because as a nurse, it is not only our duty to give patients the best care, but it is just as important to make sure that upon discharge, they have the resources they need to take care of themselves and reduce readmission. Lack of medication adherence can contribute to uncontrolled chronic disease. As a nurse, I think it is important to be aware of this issue and research ways to resolve it with patients. For my project, I wrote a short 5-question survey to ask patients. I printed these surveys out and met with each patient to ask them questions. I also looked at the patient's chart and diagnoses. I asked each patient if they took their medications as prescribed, if they understand why they're taking their medications, how they pick up their medications, and if they have transportation, how often they miss a dose of medication, and if they think their medication regimen is difficult to follow. All of the patients that I surveyed were non-compliant in one way or another. Most of them reported difficulty remembering to take their medications. Some used diaries to record what time they took their medications. One patient said he hadn't taken any of his prescribed medications in a whole month because he couldn't afford it. All of these patients that didn't adhere to their medication regimens were given tips and resources to make the regimen easier to follow. This included utilizing reminders on their phones, recording the times that they take medications, utilizing pill boxes, and making sure that they had the money to pay for prescriptions. All of the patients I surveyed did not adhere to their medication regimen. My preceptor and I helped identify the issues of those particular patients and worked with them to try to make it better. Each patient was given tips based on the particular barrier they were facing with their medication adherence. My project was well received by my preceptor. She said that the questions were concise and really pinpointed compliance for patients. LPNs in the clinic were also told about the survey to use as a resource and possibly add to their regular set of questions that they ask patients. If I had the time and the resources, I would survey more people and do a follow-up survey to see if the resources and suggestions given to them were beneficial. The most surprising thing that I learned from this experience is the complexity of medication adherence. All of the patients that I surveyed were non-compliant and for a variety of reasons. I now know that in order to fully assess patients, you must ask these questions and not just assume that they know how to take medication correctly. The most challenging part of this project was finding a large chunk of patients that were willing to take the time to be surveyed. If I could have done this over again, I would try to survey more patients and have resources readily available for patients who needed help. Thank you for watching!